chapter of Physicians for Social Responsibility, PSR Maine, of which I am co-president. Like former speakers, I'm just going to take excerpts out of my testimony because I know time is very short. But also because reducing the impact of domestic violence is a top priority for PSR Maine, I want to start with the positive impact this legislation could have on that priority. As you know, many low-wage workers in Maine are women. As I'm sure you're also well aware, the overwhelming majority of victims of domestic violence are also women. You may not be aware that one of the primary reasons that women continue to live with abusers is the fear that they will not be able to support themselves or their families. If a woman needs money to move out of an abusive situation or must have her job to do so, every dollar counts, and the risk of job or income loss can make the difference between whether she will be able to move herself and or her family out of harm's way or not. But this legislation represents one small step towards a more equitable situation and could mean the difference between life and death for a few of these women. Next, I would briefly like to discuss the positive impact this legislation could have on your own health and that of the community that we call Maine. As a physician, I'm used to giving advice on how to stay healthy. Now it is time for the Maine legislature to take action to make sure everyone in Maine can follow the advice of Maine's public health experts. For those who depend on every dollar in order to get by, taking unpaid leave puts them in a precarious financial situation. As a result, our state's public health measures are undercut by lack of a basic paid sick day protection, and your health, as well as that of your families and other Maine people, are at risk. If a person faces serious financial problems if they stay home and they think they can work, what do you think the chances of them actually staying home are? And if they don't stay home and the disease is infectious, everyone they contact on the job is at risk. One example of the risk of such behavior is the rapid spread of infectious disease, both respiratory and gastrointestinal, to the healthy in certain public health settings, like restaurants and nursing homes, when even one employee is sick. As Chief Health Officer for Maine, I responded to some unfortunate outbreaks of such illness, and it is likely that more such outbreaks will occur if no paid sick leave is available. Not only will such occurrences result in sickness and even death for specific individuals, but it will also mean business loss for some sites. Moreover, paid sick days would have another significant public health benefit. When an individual cannot take paid time off from work to deal with illness or injury, they are more likely to seek emergency room care, or they may become sicker and require expensive hospitalizations. Many hospital admissions for common chronic diseases such as asthma, hypertension, and diabetes are preventable with timely and effective outpatient and primary care. Even a small percentage reduction in these avoidable events as a result of paid sick days could lead to fewer hospitalizations and ER visits and cost savings. As many are aware, Maine emergency department use is higher than the national average. Researchers at the Muskie School of Public Health published a recent analysis of emergency room usage in Maine. The researchers state that a potential contributing factor to ER visits could be, quote, delayed care seeking by individuals reluctant to take time off from work who wait until the weekend and then find they cannot access office-based care. Providing paid sick days will help people attend to health at appropriate times and places. The bottom line is that public health costs are real. You will hear today about the price incurred by businesses who are being asked to establish a protection of up to 6.5 paid sick days per year. And it's true, there is a business cost to providing this minimum time off. But there is also a business savings, and there is a public health savings when we minimize disease, reduce absenteeism, minimize the risk of infecting customers, and make it possible for Maine citizens to stay healthy. Thank you very much.